There.
Yes, ma'am.
Glad to see all of you here today. Before we get started, I just wanted to remind you, a couple months ago I told you that I was selected to be on the interim transition team. And we're the ones that circulated that first survey. And if you checked your email yesterday, the second survey is out. And I hope that you'll all take advantage of making your voice heard, because that's what this is all about.
Are there some hard copies somewhere?
I'm sure that there would be. Let me check in the office before you leave.
Okay. Because there are people that table doesn't do email.
Okay, I'll do that.
John doesn't do email.
And this information is all going to be kind of condensed and sent on to the search committee that will be hiring our full-time minister. So it's really important that people take advantage of it. And now, without further ado, Captain Robert Johnson.
Yes.
Phoenix Fire Department.
Hello. Thank you very much. I'm here today so we could go over some CPR awareness and a little bit of first aid. Okay. For CPR, and if you've ever been certified in CPR, it has changed some. It's a lot easier for you to remember if it's not something you do all the time. Like, the fire department, every day we're doing CPR somewhere. So, but if you don't, the steps now are much easier to remember. And we used to teach it, the steps were A, B, C, airway, breathing, circulation. That's changed. Now it's CAB. CAB, okay? Compressions, airway, breathing, okay? As we're finding out that compressions only, if you don't breathe for them, compressions only actually helps a lot, okay? Now, when I say CAB, the first step is if someone just looks like they may need CPR, the first step is to just try to wake them up. They might be sleeping. If you don't check on them, they just look like they need CPR, and you run over there and just start pressing on their chest. It won't be good. And they were sleeping. They're just sleeping. Yeah, they're going to wake up. So shake them, say, hey, wake up. Are you okay? You're trying to get a response, some kind of response. All right, now, if you get no response, and that's called verbal stimuli, then we're going to do what's called tactile stimuli, or you can call it painful stimuli. Now, if you just make a knuckle like this, and the breastbone right here in the middle of your chest, if you press down on that breastbone and rub back and forth, it's called a sternum rub. Okay, it'll get their attention if they're sleeping. Okay, if they're not, you at least want to see them pull away from it. Like it's uncomfortable. Now, if you can't wake them up, even though you get a response, you can't wake them up. Even if they don't need CPR, they still need help, because you can't wake them. If you do this, now shaking them, sometimes people are just hard sleepers. Shaking them and shouting at them don't wake them up. But if you do this and they don't wake up, they need some help. They should get up to that to respond to. All right, even if they don't need CPR.
So if they react at all to that knuckle thing, they're okay?
If they react to it, more than likely they don't need CPR. But if they don't wake up and you're like putting some pain on them, they need some help. Okay, something's going on, they need a doctor to take a look at them. So you still want to call 911 if you can't get them up. Now, after you've done that, if it's an adult, and now for CPR, 8 years and over is considered an adult, and it's just because of the body size and the way the body's developed, okay? So, and that's how you're going to do the CPR for anyone 8 years old and older, all right? Now, but for someone that an 8-year-old, even though they're a kid, if it's an adult and they need CPR, okay, you're going to have to leave them and go call 911. Once you shake them, you're like, they won't wake up, they won't move, go call 911. And if they need CPR, this is the part that you're just gonna have to do. If the phone is like across the street, you gotta go over there and call 911 before you start CPR on an adult. And the reason is because you got to get the defibrillator here. They have to get their heart shocked. More than likely, if an adult needs CPR, their heart stopped working because of a heart attack. Okay, and the best thing for a heart attack is to get it shocked as fast as you can. For a child, even though they're 8 years old, you have to leave and go across the street, call. You have to guess that an 8-year-old that needs CPR, they didn't have a heart attack. You know, they don't need to get their heart shocked. They probably got into something, some poison, something in the cabinets or something like that, choked on something, fell down, hit their head. But more than likely, their heart did not just stop because of a heart attack because they're so young. All right. Now, once you've called 911, now they didn't respond to you. You tried painful stimuli, nothing. You left, you called 911, you came back. Now you go through the 3 steps. CAB. Compressions, airway, breathing. Yes.
Is precordial thump still valid, or is that old?
That's old.
School?
That is old school. That is old school. The precordial thump, and if you guys can remember that, and still see it on some of the movies, they would just boom. And okay, it's just, you just punch them in the chest. I don't know what the science was behind that back then, but apparently, for them to use it, it had to work sometimes.
Yeah, it's the physical trauma is an artificial electric shock. That was at least the thought process.
Okay, all right. They were thinking it was okay. Well, if that was what the scientists were thinking, then it's logical. It makes sense to me because of the electricity. Your heart makes its own electricity. That's why the muscles contract. So that's what for them to have it. It had to work at least some of the time for them to keep doing it. Otherwise, they would say, hey, this is not working, let's find something else to do.
But nowadays,
no.
No,
it's not working now. And just like, you know, when we used to do just the breathing and not, you know, before we do compressions, there was a time where if you couldn't breathe for them, you wouldn't even start compression. It wouldn't have made sense to start compressions without breathing for them. That's changed. If you can't breathe for them, you're going to do compressions anyway. Yeah. And that's why the compressions now are first. All right, as a matter of fact, Phoenix, this as far the change in the way CPR is done, Phoenix was one of the pilot programs, Phoenix Fire, and it was a student at University of Arizona, and just some smart kids these days, you know. They figured out that okay, there's enough oxygen left in the blood. If you can't breathe for them, just keep that blood pumping, the blood that's already in their heart. Just do it and keep it going, keep it going. And we'll say, well, in theory, he said it might work. Well, let's try it. So they've picked a few fire departments and hospitals. Phoenix was one of them. And what we found that is in the past, we would do CPR the old way. No one would ever wake up, especially adults. They wouldn't wake up right there in front of you. I mean, sometimes it would be like a few weeks later, someone would come by the station with some cookies or something. Hey, thank you, you helped us, and we appreciate what you guys do. That's happened, but we've never had anybody wake up right there in front of us to where we went to this new compressions where when we got on scene, if somebody needed CPR, before we did anything, we did 200 compressions on them right now. There's been some cases where they've had adults sit up and start talking to them. Yeah, so that's just, and that is why the CPR standards are changing. Compressions are like, apparently they're better than just the airway breathing, because the study, the results, you know, the results is what proves. The proof's in the pudding, and if it works, then it works. And we've tried it, and it does work. So, compressions first. CAB. C is for compressions. Now, when you're going to do compressions on an adult, you're going to do it in the middle of the chest, okay? And where the 2 bottom ribs meet right here, if you put 2 fingers down, you'll be right above it. Now this is, you want to be right above it because there's a little tip down here that men have. It's called the xiphoid process. Women don't have it. It can chip off. Now if it does, if you push down on it and it does chip off, the ends can be kind of sharp. Right underneath it is the liver. And you don't want to lacerate the liver because that is like a lot of blood. All right. So that is why you want to be on the middle of the chest right there. Now when you push down on someone's chest, you're going to use the heel of the palm. You don't want to use the entire palm. Using the heel of the palm, this bottom part, you get better compression, better contact with a person when they're on their chest. Now, to do that, you have to interlock your fingers like this and you pull up on one hand. Now when you do that, it's going to let you use the heel. Now what will happen a lot of times is you'll tend to put your hand flat on the chest like this, and you don't want to do that. Okay? You don't want to put it flat on the chest to push. You want to make sure it's this part of the hand. Another thing is you'll tend to want to cross your hands like this to push down. Okay, I always try to remember, interlock your fingers, pull up like this. Okay, now these are kind of steps right here that I'm showing you that if you've never had any CPR training, good to remember these kind of steps. Just a little, okay, the hand placements like this, because see, if you've never had any CPR training and you call 911, they're going to give you steps on the phone, how to do CPR, you know, because it's going to take at least about three minutes for the fire department to get there. Something should be done until we get there. Now, if you've had the training, good, you know what to do. And when they're telling you on the phone, it's a refresher. If you've never had it, at least if you remember this, you'll say, they're going to say you got to put your hands. They're going to be trying to tell you where to put the hands and stuff and how to hold it. You're like, okay, the captain was there. He was talking to us. I remember that part. Okay. So you'll remember that part. Now, when you're doing, also when you're doing it, and on TV, if you ever see the firefighters doing it, you'll always see us sometimes we're standing there doing it with one hand. Or sometimes we're like pushing, we're bending our elbows doing this, okay? It's because we got a lot of firefighters, okay? CPR is like exercise. You will get tired doing it, okay? And to make sure that you last longer, that you can do it the longest you can, if you keep your elbows locked and arms straight, and you're over the body and you're letting gravity pull yourself down like this, instead of pushing with your arms, okay? We will do it. Firefighters will do it, but typically when we're doing CPR on one person, there's about two firefighters doing CPR, and about 8 others waiting for their turn, okay, if there's somebody gets tired. So that's why we don't use that technique that I'm showing you, because we got a lot. And if you're by yourself, you can do CPR this way much longer. You will get tired, but not as fast as if you do it this way. You'll get tired real fast this way. Okay? Now, another thing is when you're doing CPR and you got to do the compressions, you have your spine right here, backbone, and in the front you have your chest bone. To make sure the blood is pumping, you have to squeeze the heart between the backbone and the chest bone. You got to squeeze it. Okay? Now, if you're on a bed or a couch and you push down on this person's chest, the whole body's going to give. You're not going to squeeze the heart. They have to do CPR. They have to be on a hard surface. Okay.
Oh, like the floor.
Or like the floor. Floor. If it's a child, you can pick them up. If it's easier for you to do it on the table, you can do that. But a grown up, kind of hard to move them. You do it on the floor. And the thing is, sometimes it may be hard, but you got to try your best. If you can't, you can't. But you would have to try to get that person from the couch or bed to the floor so you can do CPR on them. All right? And that would be important, because otherwise you're going to push on their chest and not squeeze the heart.
So if they bump their head or something on the way down, that's the least of their problems.
That's the least of their problems, okay? Because if they're not breathing, head injury is not going to matter. Okay, we got to start breathing, get that blood moving for them. Try to keep the brain, alive. And that's basically all CPR is. Sometimes, like I said, with the compressions, you'll have them wake up in front of you, but really, you're trying to keep blood going to their brain and to their other organs, just to keep them alive, get them to the hospital. The doctors are going to have the best chance of saving them in the emergency room, in the hospital setting, and not like in the emergency setting like with the firefighters there. They're going to have their best chances. That's why we're trying to do a few things to them, and then get them in the ambulance and get them to the hospital so the doctors can take over. All right? And when the doctors take over, they have a pretty good chance, because the hospital, they just have a lot of stuff there. They have a lot more than what we have on fire trucks. Any questions so far about the compressions? Okay. Now we know the hand placement. We know the arm technique. We know we're going to be straight over and going down. We're going to, on an adult, we need to squeeze at least about 2 inches. At least 2, maybe more. And that's just a regular sized person. If it's a heavier set person my size, bigger, thicker chest, might have to squeeze more than 2 inches. Okay. And when they're heavier like that, if you're not, say, their size, it's gonna be hard to push on their chest. It is. You know, that's just what I noticed. It's like, okay, it's a bigger person, takes a bigger firefighter pushing on their chest. All right, smaller person, okay, then someone smaller can actually do effective CPR on that person. To where on a big person, a smaller person doesn't have the weight to get their chest to compress enough, okay? Yes?
Do you have to worry about breaking any bones?
No, but you will feel it and hear it sometimes. You know, and you'll feel, most of the time, it's not the bones, it's the cartilage that's connecting the bone to the, because the rib bones connect to the chest with cartilage and to the ribs with cartilage. You'll hear them crackling and popping. And for older adults, CPR, you may break a rib. Yeah.
So you decrease how hard you're pushing?
No.
Just keep on
You just keep pushing, okay? Because right now, CPR is like the last step, okay? If you don't do CPR, all the other injuries doesn't matter. They're not going to make it. So you do CPR even if you're breaking ribs. If they're not breathing, that's what you're going to do, CPR. Any questions about the compressions again? Yes.
With someone sick with like a Mara chair, she's pretty frail.
Yes.
Wouldn't you need to vary the strength of your compressions? I mean,
No.
you would need to.
No. No. And it's not the strength, it's like, it's the rate, it's how fast you can do it, okay? Because you got to do it 100 times a minute, okay? For a bigger person, 100 times a minute is going to be like, you know, a lot more strength. And if you're a smaller person, you'll feel 100 times a minute, okay, I don't have to work as hard, you know? I'm doing it like this. So what you're gauging it on is how you got to do it fast enough, okay? And if it's harder to press down on someone's chest, it's going to take a lot more energy out of you. And if it's not as hard to press on someone's chest, it's not going to take as much energy out of you. Does that make sense? Yeah. So it's going to be the rate. That's what's going to be your deciding factor there.
So the rates changed too from old school.
The rate has changed. Yeah, it used to be to where you're trying to do like, I think it was 60 times in a minute, 60 compressions. Okay, you got to get 100 compressions in a minute. Okay.
There used to be a song that you could sing that set the rate.
I don't remember the song. Yeah. I didn't get the song.
I don't remember it either. Evidently it's not valid anymore.
Well, it's gonna be easy because, see, you have to remember for the adults, okay, this is how many times I breathe, this is how many times I push. For the child, it's even different. And then for the infant, it was different, okay? For everybody, you're gonna compress on their chest 30 times. I don't care who they are. It's 30 compressions. You're going to give them 30 compressions, you're going to give them 2 breaths. It's 30 and 2 for everyone. Whether they're adult, child, infant, it doesn't matter. It's real easy to remember now. Okay? Now, you used to have to check for pulses. Firefighters in the fire department, we still do. But if you don't do this every day like us, for you to see if their heart's not beating, coughing, breathing, moving. If they don't cough, they don't breathe, they don't move, their heart's not beating. That's what you're going to assume, okay? And if they don't do that, then you're going to do CPR. All right, we've done the compressions. Let's go to airway. Now, and remember, it's 30. Well, let me go back to the compressions so I can show you the rate and I say how fast it's got to be. No, if you count, it's almost like there's no and in between the numbers. Where you say 1 and 2 and 3. It's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. That's how fast you got to go now. Okay? It can get you tired. It can get you tired, you know. Especially, you see, because when it's the fire department, we're doing CPR. Most of the time, people, we don't know the family. We're doing it, and without the anxiety focus like that, we're just like, we know we got steps that we have to go through. Our training just kicks in, and we do what we do all the time. Okay, what if it's a family member, a friend? Now all of a sudden, the anxiety level changes. And you got to remember this. Not only do you got to remember the steps, but now you think, okay, wait, this is my family member, my friend. So got a lot of the stuff playing in. And then that's going to zap your energy also. Okay, so if you have to do CPR, the best thing to do, try to do is stay calm, even though it's a family member, friend, and remember the steps. And Whatever you do, be calm and listen to the person on the phone, to the 911 operator. Because a lot of times, there's 2 calls we talk about a lot where 2 little kids, one outcome's not good and one is. It was a drowning. Took the kid out of the pool, laid him on the countertop. 8 adults in the room crying. Nobody does anything to the kid till the fire department gets there. The kid doesn't make it, okay? Now, because they were upset, like I said, this is anxiety. I know we're saying, oh, but you know, what if it was your kid? You might react the same way. You don't know. Hopefully you wouldn't, but you don't know because it's your kid. If it's somebody else's kid, you might stay cool, but if it's yours, the anxiety level changes. Now, there was another call where, and in both of these, neither one had CPR training. Another call, teenage girl. She's on the phone telling mom what to do. Pull brother out of the pool, stays calm, the operator's giving her directions. Mom follows the directions as far as everything the operator's telling her about CPR. This kid coughs up water and starts crying before the fire department gets there. So stay calm on the phone. Okay, do what they're telling you so something can be done until we get there. All right? Now, we talked about compressions, we talked about the rate, techniques with the arm, this part of the hand. Let's go to the next step, which is A. We done C. A is for airway. Kind of an easy one. Airway, just open the airway. When someone's very unconscious, they will get so relaxed when they're laying on their back, their tongue falls to the back of the throat. And it blocks the airway, they can't breathe. All you do, 2 fingers on the chin, hand on the forehead, lift. It's called head tilt chin lift. When you do that, it pulls the tongue away from the airway and now air can move in and out. Sometimes they might start breathing just by you doing that. Okay, but they might not. But that's all you have to do to open the airway. Just like that. Now there's another method called jaw thrust where you just give them an underbite. You're pushing this part of the jaw forward. Okay? It's above this training as if they hit their head and you don't want to injure their spine anymore. Okay? And that's what you use. And to do that, it's hard. One person can't do it. You need 2 people. You have to have one to do this while the other one's doing CPR and breathing. Okay? Just to hold it open, it takes 1 person. Okay?
Are you still supposed to check for gum, food, candy, obstacles?
Only, and I'll go over that step, but you only do that if you can't get air in.
Oh.
Okay, we'll go over that. Okay, but yeah, you only do that if you can't get air in. All right. Now, the airway part, that's it. That's the easy part. You open the airway. Now, once the airway's open, you go to B, breathing. Okay. Take a couple seconds. Look. Now, this is what they're going to do. The chest is going to be doing this if they're breathing, looking at the chest. All right, and seeing if they're going to move. Okay, they don't breathe in just like 2 or 3 seconds. You're looking, no breathing. Okay, give them 2 breaths. All right, and this is how you're going to do it. Get my mask. And these right here are just for training. You can't buy these and use them for real on real people. They're only for training. They do have some that are similar to this that you can use for doing CPR. This is for training purposes only. That way, when we do these, we just clean them when we get back to the office. To where before we were using these, between every person you had to alcohol wipe and clean it and make sure for the next person. Then you alcohol wipe, clean it and make sure for the next person. Now everybody gets one of these, and then when we get back downtown, we'll clean them for the next group. So now I'm going to use this to show you, and this is the part I'm going to put over my mouth. This is how you do it. When you're going to breathe for someone, you have to close their nose. Because if you don't, you breathe in the mouth and then the air comes out of the nose. So close the nose, and with the airway open, you got to open your mouth wide and get a good seal over theirs. But when you breathe for them and your anxiety level's up, don't blow in too hard. Because if you do, instead of the air going into the lungs, it will go into the stomach, and that's not good. Okay, you got to breathe in slow and deep. And you'll see, as soon as you see the chest start rising, you got enough air in the lungs. You can stop. And when you do stop, the chest is going to fall and the air is going to come back out. You'll know you're breathing into the lungs. Because if it goes into the stomach rises, the abdomen rises, and it doesn't come back out. Okay, and if you get too much in there, when it does come out, everything in the stomach comes out with it. It's not good for this person. Okay, so you don't want that to happen. So, with that open, you're done the compressions. That open, you're going to give them 2 breaths. Okay, now you've given them 2 breaths. You've done C, A, and B. So now, you're going. C, A, B, you're doing the cycles. Okay, 30 compressions, 2 breaths, that's 1 cycle. All right, you got to do about 5 cycles before you stop. So you're going through 5 cycles. After the 5 cycles, stop, take a look at them. Not a long time. Just a few seconds. Coughing, breathing, moving. Okay, and of those, the most important one, the breathing. If they're not breathing, because see, you can, if they're not breathing, your heart can still be pumping. But if you're not breathing, guess what? That heart's not going to be doing that for much longer. If they're not breathing, you are going to do CPR on them. You're going to do the 30 to 2, because they're not breathing. That's basically what it is. If they're not breathing, you're going to do CPR, the compressions, and the breathing. Any questions about that part?
What happens if you push on the chest and their heart was still beating? Like they stop breathing.
They stop breathing. Okay, if they stop breathing and their heart's still beating, you're going to push on their chest to keep that blood moving. And you're going to interrupt their normal heartbeat, but it's going to be interrupted anyway. I mean, if they don't start breathing, it's going to be, they're going to stop. The heart's going to stop because there's no breathing. So that's why the logic is, well, go ahead. They're not breathing. Do CPR. You know, at least until we get there. When we get there, we're going to start hooking things up to them. We got to check the pulse, which you guys don't have to check. We got to look for pulses. We got to check the quality of the pulse. When someone's doing CPR, we got to check the pulse. Because when they're doing CPR, you should be able to feel the pulse every time someone pushes down. Okay, a lot of things we do that's not in this. There wouldn't be in this. And this right here is just awareness. Certification for this, what I'm talking, is it's like 4 hours. Okay, and a lot more training than what I'm going over right now. But just the information I'm giving you right now, if you had to call 911, your memory would start coming back. Okay, I remember that. That's right, he did talk about that. You know, because you don't do it every day. You could take a CPR class, a 4-hour class, and 2 weeks from that day, you can't remember half the stuff you took. Why? Because you don't do it all the time. I mean, we got to get this training yearly. You know, every quarter we go in, 3 months we got to go get some training in EMS and medical services. It's a career of training. You never stop training as a firefighter. From the day you start to the day you're done, you can always certify, recertify, training, new stuff coming out, new technologies. Okay, bring us up to date. It never stops. You always do it to where if you take a CPR class, you're not going to always do it. And that's why I brought these. You're going to have, and like I said, you make copies, we don't care. Make as many copies you want to. Many people have these, the better. It's CPR, steps of CPR right here. 2 firefighters going through all the steps. Yeah. Yep, English and Spanish on one. So, and the phone number is on here about certification classes. The 4-hour classes I was telling you about. All right, any questions so far on the CPR?
Are the classes for free?
No, they're not. The classes are, I think they're either $20 or $25. That's just for the CPR with the defibrillator. CPR with first aid, it's like 8-hour day. I don't recommend doing those both in the same day. I don't know about you guys. I don't like sitting in classes like that for 8 hours in one day. But yeah, and it's like for CPR and first aid, I believe it's something like $40. But just for the CPR with the defibrillation, it's like either $20 or $25.
What's your thinking on a home defibrillator?
Home defibrillator? If you witness, you're standing right here, and you got someone standing right here next to you, and they actually do have a heart attack right there in front of you, and they're like, oh, and then all the symptoms, and they fall down, they're not breathing. If you know how to use that defibrillator and you get on them right now, That is the best thing that they could have done for them. The best. See, now what happens when you have a heart attack is your heart stops getting the oxygen, and then it stops beating like this, it starts beating like this. It's really just quivering. You know, and it's not pumping any blood, it's just doing this. Really small contractions. Well, what a defibrillator does is it shocks it and takes all the electricity away. The heart actually stops. And when the heart stops, then your body takes over again. Okay, here we go. We're starting new. You know, and that's what the defibrillator does. It stops it so your body can reset. It'll reset, your heart will reset itself once it's stopped. So that's what a defibrillator does.
So when you use that on someone, do you check their pulse right away and make sure that their heart
No.
actually started again?
No, if they're not breathing, okay, we're going to assume they're not breathing, they're pulseless, they don't have a pulse. So if you do get the training and they're not breathing, you go get it and you put it on there. These kind, they're not the kind that the paramedics, these are for like, even if you're not an EMT, you can use it. You put it on there, you put the pads on, you don't even have to, just take it off, turn it on. Take it off, turn it on, and I'm saying put the pads on. This is what the machine gun say. Put the pads on the patient. And it's going to say, put this one here, put this one here. So he did that. Then they're going to say, okay, don't touch patient. The machine's talking to you. Don't touch patient. Analyzing rhythm. So you make sure nobody's touching it, and it's going to see if the heart's beating. It's going to see, and it's going to say, okay, shock not advised, continue CPR. And it's going to say, okay, shock advised, make sure everybody's going to tell you what to do. And then it's going to say, okay, press the button. And you press the button, shock them, and then it's going to say, wait a minute, it's going to say, hold on, and it's going to continue CPR. It just tells you what to do. Yeah. Yeah.
Do you use a defibrillator in any situation without doing CPR?
No.
You wouldn't do.
You're going to always, if you put a defibrillator on there, you're going to always be doing CPR. Either that, or the defibrillator is going to say this: not a shockable rhythm. Check for pulse. That means the machine is saying, hey, this guy's got a pulse. We don't need to shock him. We don't even need to do CPR if they're breathing. Okay. The machine's going to tell you. You know, it's going to tell you what to do. It's just, but this is just a little part of the training. You have to go to the 4 hours to be able to use that defibrillator on the wall.
I'm curious about something. I have a defibrillator.
Uh-huh.
So what happens if you arrive and I've had some kind of an episode? What do you do?
The fire department?
Yeah.
Oh, our training is different. Our training is different. We're going to get 800 compressions. We're going to come in there.
Even though my defibrillator is going off.
Your defibrillator, is it, what do you mean? Like,
It's implanted.
It's implanted. Okay, that's a pacemaker.
And
And the defibrillator is both.
Yeah.
Okay. If that's the case, now the medics, see, and that's above my training. Okay. Only thing I can do is CPR. Now the medics, they have a defibrillator that doesn't talk to you. They have to be able to put the stuff on you, look at it, and say, this is what you have. Okay, and then they're going to start calling the doctor. Hey, well, this is what's going on. Now, regardless of what's going on, until we figure out what's going on with the defibrillator inside you, if you're not breathing, you don't have a heartbeat, yeah, it's going to require CPR no matter what. That's what we're going to do. We're going to do CPR. We're going to put our monitor on you, and if our monitor says shock you, we will. That's what we'll do.
well, my understanding, this has never gone off on me, but it really kicks you on it might kick you on the ground.
Oh, if you're awake, if it does like what we have,
Yeah.
uh-huh.
And
It's, yeah.
So our fireman hesitant to touch me because I guess if you're touching me, you'll get
Yeah,
shocked.
you'll get shocked too. No, we're not going to hesitate to touch you. We're just going to hope, you know, we're going to, just because of our monitors, we're going to get you out of any water. We're going to lay you on a dry surface and we're going to touch you. We're going to touch you. That's not going to be the only risk we're going to take. I've risked my life a few times, you know, so that's not the only risk we're going to take, touching you if you got a defibrillator. So, but we will.
I've been curious to know what happens.
Yeah.
Other than I've heard it kicks you on the ground.
And the thing is they're gonna even though they're medics and they got a lot more training than everybody has to be an EMT, but some of the medics, they have quite a bit more training than EMTs. They will still have to call the doctor on that. They're gonna say, Doc, he's got internal defibrillator, and the doctor's going to have to tell them, shock them anyway. Yeah, do this, do this. They're going to tell them anyway. They're going to call them and get some advice. But even before we call to get advice, if you need CPR, that's part of our training. That's what has to be done.
Did you just say that the firemen are also EMT trained?
Every firefighter has to be EMT. I'm an EMT. But you can take, it's a step above to be a medic, and it's like 6 months worth of training. They can do like invasive things. I mean, they can cut your chest open in your bedroom right there and put a tube in there. I mean, they can do things. There's a lot of training they do that EMTs don't have. Okay. All right. Any more questions on the CPR part? All right. And we covered
Well,
the
you
5
hope
cycles.
after you've done 5 rounds,
Yeah.
that the
5
firemen are there.
Yes, but you know what though? 5 rounds, they're probably not going to be there. 5 rounds is typically a minute. Okay, maybe a little more than a minute if you're doing it fast enough. It's a little more than a minute. Okay, so and that's why after that you stop. Okay, no coughing, moving, or breathing. You continue CPR until we get there, or they cough, breathe, and move, or you just can't go anymore. You're tired. You're exhausted. I can't go anymore. Okay.
Just to recap everything you've said, could you demonstrate as if you walked up to the
Yes.
person having trouble right now on that
Yeah.
table,
Uh-huh.
and how you would do it, how fast you do
Okay.
it, what the heel, and
Yeah.
you mentioned everything as you go through.
All right, I'm coming through.
Yeah.
And they look like they need CPR. Maybe they're turning blue around the lips or something. It just doesn't look right. I'm trying to wake them up, get a response. No response. I'm trying something painful. Still no response. This is an adult. I'm by myself. I'm leaving. I gotta go call 911. I'm going to call 911. I'm coming back. Okay, they didn't wake up, right? So I know that I couldn't wake them up. I didn't see them cough. I didn't see no breathing or moving. They need CPR. Okay, interlocking my hands. I'm pulling up on my hand, interlocking my fingers, pulling up on my hand, keeping my elbows straight, and right in the right spot on the chest. Now I'm going 30. 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 5, 6, 7, 28, 29, 30. Airway. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 5, 6, 7, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 4, 5, 6, 7, 28, 29, 30.
Now, if you saw movement right then, then you would stop.
I would stop.
Process, right?
I would stop. If they moved, okay, if they moved, their heart's beating. Now, and they moved, they're breathing. Their heart's beating, they're breathing. This is the logic behind the doctors making the steps like that for if you're not like in the medical profession. That's the logic behind it. If you're moving, you can move something, you're breathing and you have a heartbeat.
So you continue to monitor and watch
Till we get there.
comes in case they stop
Right.
breathing, and then you start the process.
And this right here, on the side,
Yeah.
laying them on their side, pull one knee up so that they don't roll back, okay? This is called the rescue position. Because now if they do throw up, you can just clear out the airway, and if the vomit won't block the airway in this position.
So when you gave the 2 breaths,
Yes.
if you tried to breathe in and you couldn't, that's
Yeah.
when the thing that she was talking
That's
about.
the next step I'm going to get into,
Okay.
all right? And that's choking. We're going to go cover choking next. Any questions about the CPR? Like if you walked up to them or even if you saw them, right, just do it right in front of you. That's how you do that. Now, choking. If they're awake, universal sign for choking is the 2 hands to the throat. Most people do that. Even little kids do it. This is a universal sign for choking. If someone does this, and this is kind of, I never understood this part of the training. You're supposed to ask them, are you choking? Okay, that's part of the training. That's part of the training. Are you choking? Now, really what you're trying to do is you're trying to see if they can talk. Okay, when you ask them if they're choking and they say, yeah, I can't breathe, you know, they can, then they're moving air across their vocal cords, and you're supposed to encourage them to cough. You know, and the hitting them on the back, right now, the logic is if you hit them on the back, it dislodges it, but gravity pulls it back down in. So you don't hit them on the back if they're standing up. That could change, I don't know, you know. But right now you don't hit anyone on the back if they're standing up and they're choking. Now, if you ask them if they're choking and they do this, they can't say a word, they can't move any air. You got to help them, tell them you're going to help them, okay? And that's when the Heimlich comes in, or we call them abdominal thrust. You get behind them, put your leg between theirs. When you reach around them, you're going to try to put your thumb in their belly button, because if you can, and roll up, it'll put you right above it, and that's where you want to do the abdominal thrust. You reach around with the other one, and it's not a squeeze, it is a thrust. That's a squeeze. This is a thrust. You're making a cough. You can do it to yourself. And you keep doing it until it comes out. And then when it does it, you know, a minute comes out. All right? You keep doing it until it comes out. If it doesn't come out, they're going to go unconscious. Okay? If they go unconscious, you let them go to the floor. Don't let their head hit the floor hard. That's the only thing you're trying to protect. The rest of the body hits the floor hard, but not the head. After that, yeah, CPR, because they're unconscious. Yes.
One of the things that I learned that stuck with me is if you're trying to give them the Heimlich and they're fighting you, just wait. Eventually they'll pass out and then you can get about your business.
Yeah, and typically, and that's why I say you always tell them, I'm going to help you. You're choking. If you don't tell them that, they're choking, and you jump behind them and just start doing this and you ain't said nothing to them, and they're already choking, their anxiety levels up, they might just like, you know, well, you get off me, you turn, you know, what are you doing? No, you got to tell them, I'm going to help you. Okay.
Show us the placement again.
Okay, you put your thumb in the belly button, roll up. Just a little bit above the belly button. A little bit above it. Okay, someone who's pregnant, baby, don't do it to the baby, okay? You know where the spot where you do CPR? Right there. Same thing, okay?
Now, if you're alone,
Yes.
and you're choking and there's, you know, no one around, you can just use the corner of a counter.
You can use a chair, you can use it on, you can do it on the chair, you can do this to yourself. If you can't do that, get to the phone, dial 911. I know you can't talk, but if you dial 911 and you just leave the phone off the hook, we're going to come to the house. And if no one answers the door, we're not going to leave. Well, you didn't answer the door. Must be a bad call. Let's go.
So
that's why we always tell the kids, don't play on the phone. Don't call 911, play on the phone, and go hide in the closet. Because if nobody answers that door, the fire department's coming in, one way or the other. We're going to come in.
So that's the general rule of thumb. Even if you can't talk, leave it off the hook.
If you call 911, and we will know where that phone call came from. The caller ID blocking does not work with 911. If it's a landline, we know where it is. If 911 comes from that call, we're coming there. If nobody answers the door to tell us what's going on, we will be coming in. We'll be coming in. It's just, that's how it works. Huh?
You can't use your cell phone?
If you use your cell phone, we don't know where you are. They got to triangulate it, takes longer. Yeah.
So what's the time period in a heart attack? If I feel that I'm getting the chest pain and stuff,
Yeah.
will I generally have time to dial 911, or am I?
Generally, yeah. Generally you will,
Okay.
and if you start feeling that, Bayer is, if you feel it right then, man, Bayer is supposed to, you know, from what doctors are saying, matter of fact, we carry it on our trucks now.
What?
Kid aspirin, Bayer aspirin. If somebody's having and they're giving you the symptoms, classic symptoms, the heaviness on the chest, you know, give them 2 Bayer right there. We do it right there.
The child aspirin
Right one?
regularly. You take another one.
Oh, if you take it regularly, our standing orders is to give you 2, even if you take, because it's aspirin. Yeah. If you have those symptoms, yeah.
Since time is of the essence in most cases, no matter what condition, mild to major. Have you had a lot of good experience with the Med Alert 800 number bracelets and with the First Alert? I mean, we have a more mature audience here.
Yeah,
they have some health issues and have, you know, different kinds of home environments, assisted living or whatever.
That has helped out. That has helped out. Like you say, if there's no one around to help us, like, because we like it when we pull up and then we got a waiver. Somebody's doing this, okay, drive towards that person. And when we get there, they're going to tell us exactly where the person is, where we're going. And when we get there, we hope there's someone there and say, this is his name, his medicine, he's taking all this, blah, blah, blah. If we don't know and there's no one around and you have that, helps out a whole lot, a whole lot.
And do you guys check those things? Like, I keep maintaining one of those things on my refrigerator that says what meds I've taken as I live alone.
Yeah, we look, we check those, because on the forms, like, we got to put down, we're going to ask you the medicines you're taking because we got to write down. If we can't ask you, we're going to look in the refrigerator in the medicine cabinet. You know, we just look, okay, is her name on there? Is it expired? No, okay, she's taking that. Okay, you know, that's where we're going to, because the doctors want to know.
Yeah.
And we got to put it on our form. And there's certain things that the medics have in their drug box they can't give you if you're taking this, you know, it's like, and they have to know. So, yeah.
Did you say you take 2 baby aspirin?
Yeah, 2 bear.
2 regulars?
2 bear. No child, the kid aspirin.
Child.
Yeah.
Okay.
Yeah. But talk to your doctor. Your doctors will tell you, because some like the gentleman here was saying, what if you're doing it like on a daily basis? Well, medics can't tell you to do that. We can't say, hey, take this on a daily basis. Your doctor can. They'll tell you. All we can do is the orders that we have that are standing, that we have a doctor, we're working under his license. We're going to do it because he said, if this happens, do this without asking anybody. Do it.
Yeah.
Okay, that's what we do. Yeah. Okay. And then there's some things, okay, before you do this, call the hospital, you know. But there's other things, it's like, okay, if this is happening, you do it. It's standing order. You just do it. Okay? Yes.
I didn't have a heart attack, but I had an episode, something's going on, and I took an aspirin right away and went to the hospital, and they told me that saved me from having a heart attack.
Yeah. It's when you start feeling them, if you take it right now, and I guess the Bayer, you know, it's kind of like a blood thinner. It's working, you know. It's, you know, the theory behind it. Someone thought, hey, what if they do this? It might work. Well, it was theory. Well, they put it into practice, and they found out it works. So, you know. Yeah. Now, the choking. They go unconscious. You're going to do CPR. Now, this is where the one part where you can't get air. They're choking. You're going to do CPR. Nothing changes. It's, we used to have, okay, you get on them, do abdominal thrust this way. Okay, no. If they go unconscious from anything, choking, whatever, do CPR. 30 to 2. Now, this is going to be the difference. You're going to open the airway. You're going to try to breathe for them. Well, they're choking. You can't. You can't get any air in. Hey, try to breathe for them again. Yeah. No, can't get any air in. When you can't get air in, the extra step is look in the mouth. Look in the mouth. Okay, I can't get air in. Look in the mouth. If I see it, I try to finger sweep it like this. You start a finger here and try to sweep it out instead of pushing it down in further. If you can get it out. If you don't see it, yeah, keep on doing CPR. 30 to 2. I can't get air in, so what do? Look in the mouth. I don't see it. I keep going. 30 more. I try to get air in. I can't. Look in the mouth. I don't see it. Okay, 30 more. And see, by doing that, a lot of times you keep pushing it up. Just the pressure on the chest keeps pushing it up more and more to where you can probably see it and get it out.
Shouldn't just reach in first?
No, not unless you can see it. No blind finger sweeps. You have to be able to see it. Okay? And that is as far as, okay, what if you can't get air in? There's only one added step. Look in the mouth. Okay, and then if you see it, you'll take it out. Otherwise, you're just going to keep doing it until we get there. Yes?
Another thing that might be old technology, I'm showing how long ago I've taken this. We were told that if it's not coming out, blow hard and try to blow into the lungs.
No.
Not
because see,
anymore.
if you blow hard, remember what I said, blowing hard, and do that epiglottis, you got this little flap of tissue there that blocks food from getting into your airway. You know, if you blow hard, you're going to overtake that epiglottis, you're going to blow the air into the stomach. Okay, air into the stomach is not good. It's okay going in, but coming back out with the vomit, the person will get what's called aspiration pneumonia. The acid will corrode the lining of the airway, and they get pneumonia from it. And sometimes that pneumonia can be fatal. They made it through the CPR, but because of the aspiration pneumonia, and then they died a few days later. So, you know. So that's why it's good not to get air into the stomach. Yes?
I'm allergic to all kinds of antibiotics. Should I be wearing an indicator for that, or is that farther down the road than an EMT? Or
That's farther down the road than EMT. We don't have any antibiotics on our truck. We won't be giving you anything like that. Most of the drugs on our truck are for pain and they're heart medicines, like for heart attacks.
How about codeine?
Codeine, it's on there. Well, not codeine, but morphine.
So if I'm allergic to codeine, should I tell you?
Yeah, if we don't have codeine, but if morphine will get the same reaction, then yeah, we would want to know. See, I don't know if codeine and morphine will get the same allergic reaction to each other. You know, if a person's allergic to codeine, can they take morphine? I don't know. Yeah, yeah.
It depends on the allergic reaction you get, because I'm allergic to codeine, but
Yeah, and typically, if you're allergic to it, we just don't want to give it to you unless, I mean, because see, if it's a severe allergic reaction, that means that your tongue and your airway will swell up and close off your airway. That's the most thing that we're concerned about as far as allergic reaction. If the docs say give it to you anyway, that means we're going to give it to you and protect your airway. We're going to put a tube down your throat just in case you have that type of reaction. But typically, you know, the doctor will make that kind of medics won't make that decision by themselves. You know, on their, you know, they had extensive training, they haven't had the doctor's training. You know, 8 years of school. So we go by what the doctors say. All right, any questions on the CPR and the choking? All right. Now this is going to be fast, just because I got to go to another one I have to get to. I just want to go over some quick first aid. Okay. Now, and a lot of it, especially for older adults, fall injuries, falling, and my wife, she's an instructor. She's like a silver sneakers instructor, and she's always telling me. She says, she's always telling me, this guy coming to my class with a cane. Okay, it's been 6 months. He doesn't have the cane anymore. So I was like, so those classes helped. All right, as far as, you know, just your physical mobility. All right. Now, fall injuries, anything like that, bleeding is basically first aid. Bleeding, okay, broken bones. Anyone break a bone, okay, you gotta call 911, try not to move it. If they're in such a pain, I mean, the break is just like, you know, it's like the kind you see on TV that makes you not want to look at it, you know? It's like, okay, if it's like that, then, and they're in really just so much pain, you may have to straighten it out just to help them out, you know. But other than that, you just don't move them and call 911, especially they're breathing and talking to you. Okay, don't move them, call us. Yes.
If you have pain pills at home that you can give, should you do that?
No.
Or does that hamper your evaluation?
No, don't give them anything, because you'd be playing doctor if you do that. Okay, you set yourself up. You know, I mean, just don't. I wouldn't do it. Don't give them anything. Okay, just give them some help. Yes.
What is this silver sneaker thing?
Silver sneakers. That's like aerobics. It's aerobics, but it's for older adults, and it's to prevent. It's to it's to make you do. Because see, when you get older, some things are just hard. Like just to take a shower. Okay. She says she get them in her class, and sometimes there's like 90-year-old. They couldn't barely get in the shower. 6 months later, they take a shower without help. You know why? Because they're going through the classes. And see, the thing about the classes is not because they're not like very strenuous. Like, I don't want to do those. Those hurt.
some of them you hold on.
You advance. Yeah.
Yeah.
You know, and it's not like, okay, I want to really do this hard so I can get better. It's not the intensity. It's like, it's the consistency. Like, don't go, like if you join the class, well, I want to go today. We'll miss it today, we got that. I'll go tomorrow. even if it's just 30 minutes, it's the consistency that you do 30 minutes every day. You will actually absolutely notice a difference. It's the consistency. Even if it's only 20 minutes, but you did it every day. Yeah, works wonders. Yeah, you'll find out, you're like, wow, I couldn't do that. I can't believe I'm doing that now. It feels good, you know? It's like, it's good, yeah. All right, now, as far as broken bones, like I said, you can try to, if you do any splinting, you splint it like it is. Okay, if it's broken and it's like this and you're gonna splint it, just keep it in the same position, tie it down to something straight or hard, and so it doesn't move any more than it already is. That's it for broken bones. Okay, now for bleeding, the best thing is direct pressure. Okay, the tourniquets, we're not doing tourniquets, you guys won't be doing tourniquets. Okay, they used to teach pressure points. Okay, there's like an artery here, as you got a main artery here, if you're bleeding down there, press on the artery up here to stop the bleeding down there. You don't teach that anymore. Direct pressure. If I'm bleeding from here, I want to put pressure on it right there and keep the pressure on it until it stops. Okay, then I'm going to get some bandages, and it's still bleeding, put the bandage on there, pressure on it, wrap it up. Okay, if it bleeds through the bandages, this is what you don't do. It's time to replace the bandages. Don't take it off and put some new ones on there. Leave these on there, put some more on top of it. Okay, just wrap it up some more. Okay, they'll do all that at the hospital if you can't stop the bleeding. All right, and if you can stop the bleeding and the scar looks like it's something that should get stitches, you still need to go to the emergency room. Okay, you get a little cut, you stop the bleeding, you're doing all the direct pressure and everything, stops, I don't need stitches, okay, I don't need to go see a doctor. I'm just going to put a Band-Aid on it, let it heal, put some Neosporin or something on there, keep it clean, soap and water, that's it. But if it's something, okay, I'll keep putting it, I'll keep soaking all these things and it won't stop bleeding, okay, now you need to go be seen by a doctor, because it won't stop. Especially, and see, like if you're on the aspirin regimen, it thins your blood. So now it's not coagulating and stopping bleeding like it would if you weren't on the aspirin. So just things to watch out, get it to soak and then it stops. It's like, okay, I think it stopped. All right, I think I'm good. Okay, I don't need to go see the doctor. If you can't stop it, it just keeps on bleeding, yeah, go see a doctor. Any questions? Because first aid was pretty simple. Any questions about the bleeding and the first aid, the direct pressure? Okay. All right. One other thing I'll do, I want to show you before I go, is these right here. You can buy them at the college bookstores. You can buy them at medical supply places. Thank you, sir. Now, right there. Okay, that is a face mask, okay? Now, all right, now, this right here is a filter. It's a HEPA filter. So if you breathe through it, and see, you would just, it's for doing CPR, you can hold it on and breathe for them, okay? Now, what it does is, this HEPA filter, it would only allow your breath to go in, and anything coming back is filtered out. Anything as small as a hepatitis virus. That's why it's called a HEPA filter. So this way we go to these. If you think you're going to do it, say, I'm a firefighter, I carry one with me just in case I ride by a crash or something and I need to, I'm not at work, but I want to help. So I have one. If you're not a firefighter, I'll tell you this, more than likely if you have to do CPR on someone, it's going to be someone you know, more than likely, a family member, friend. But even if not, if you want to buy one of these, it does give you a little bit more protection. Any questions? Okay, I have left, I'm going to leave these here, like I said. We don't care if you make copies and give them to people. If you have the means, the money, make 1 million copies, give them to 1 million people.
We have a website
Yeah.
that we put presentations on and stuff.
If you can get that on there some kind of way, we don't care.
I already talked to
okay.
him about
Oh,
it.
you did?
This is like CPR. You know, in Seattle, Seattle is like, I mean, their fire department, as far as CPR, they say if you're going to have a heart attack, Seattle's the best place to have it. Because like almost like 90% of the people that live there are trained in CPR.
Really?
Yeah. Yeah. See, now we can't train people, but man, if you guys want to put this on your website, and you know some other people want to put it on theirs, we don't care. Yeah.
Makes your
This is
job
good
easier.
stuff right here. So, yeah.
We're fortunate that here in Phoenix, the response
We do.
is very quick.
Yeah.
And
Phoenix is known. Phoenix is well known, not just in the United States, but we get fire department members from England, from Australia. They want to come here to see how Phoenix does it because of our management style. We're probably the most progressive fire department in the world, I think. So, but they want to come see how Phoenix does things.
And
Phoenix
you
Fire
guys
is
are
really.
always so kind when you're on a call. You're so kind to the people.
Well, that's going to have to keep going. You know, I think you know, every organization you have with, you know, a couple thousand people like this, can't say we're all going to do that. You know, but if you get one or two that's not, then you got enough of us that'll get on that one or two. So, you know, so yeah.
Wonderful.
Yeah.
All right.
This is great.
You're welcome to stay for lunch with us.
Well, you know what? I thank you for the offer, but I have to go. So. No, you didn't get to see baby. I didn't have the time.
And give me a week and this will be on the church
All
website.
right, great, thank you.
Thanks very much.
You're welcome. Glad I could help.
Okay. Thanks for setting me straight on all my old training.
All right.
Thank you, Captain.
You're
That
welcome.
was very informative. I worked at Good Sam for 35 years, and they always taught us about CPR, and they always told us.
Open the eyes of my heart, God. Open the eyes of my heart. I want to see you. I want to see you. Open the eyes of my heart, God. Open the eyes of my heart. I want to see you. I want to see you high and lifted up, shining in the light of your glory. Pour out your power and love as we sing, holy, holy, holy. Holy, 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 I want to see you. Open our eyes, God. We want to see Jesus, to reach out and touch Him, and say that we love Him. Open our ears, God, and help us to listen. Open our eyes, God, we want to see Jesus.
That's on fire, that's her prerogative.
But she has some dietary issues.
We all have our own choices.
We all have our phobias.
I always say it's blessed, you know. Blessed covers a lot of multitude of sins. It's like a coat of paint on the wall that hides a lot, right?
Did you get your yard all how you wanted?
You know, I finally found a service, and what they do is they go to homes. I found them doing it when I was showing the home. They go to a home like that's bank owned, and they want a less expensive service, but they do it quickly. So there's like 5 of them that land, and they just like sweep and blow, and they're out of there in like 20 minutes. And they charge $40.
Wow.
And if they trim, it's extra. But I still did saw off my palms, and I'm going to trim my ficus, and that little stuff around. I'll rake that and throw it in the, get rid of it. So they'll come once a month for $40. I think that's the best I'm going to do because everybody else was having to drive out to the property. So they wanted $100. That's quite expensive. You give all the time. So that's taking shape. Now if I can just find someone else with that interior. I just baffled through the time because I've tried several people who visited think of the lady with glasses in the Bible study. I thought she was agile and movable. She was able to think, the organizer, put, 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 the organizer.